Hi everyone, and thank you so much for joining us for July 26th Medicare Minute. Today we're doing a deep dive of Medicare and Medicaid, how they work together, and what you need to know about the two. So first, we're going to talk about Medicaid basics. So what is Medicaid? Medicaid is a federal and state program that provides health coverage for certain people with limited income and assets. Each state runs different Medicaid-funded programs for different groups of people. So if you aren't from Maryland, because that's where we are, you may want to go and look to find out what your Medicaid system does in the state that you are in. Income and assets must be below a certain amount to qualify for Medicaid. And income and assets limit vary, again, from state to state. So it's important to make sure that you're getting information from the state that you live in. So who is eligible for Medicaid? Groups that might be eligible for Medicaid include older people, disabled people, children, and pregnant people. All states have Medicaid programs for people who need nursing home care, long-term care, and home health care. Some states have additional programs, so it's important again to find out if you may qualify for those programs. So you want to make sure you double check with your program in your state to see if you qualify for anything additional. Medicare and Medicaid enrollment. If you're eligible for both Medicare and Medicaid, again, that's based off your income and assets level, you may be referred to as dually eligible. If you're dually eligible, you may have additional coverage options available to you, like dual eligible special needs plans or a D-SNP plan. D-SNPs are designed to coordinate your Medicare and Medicaid coverage. So it makes it a little bit easier, and it's like a all-in-one plan for you to use. So let's talk about Medicaid and Medicare coordination. How do they work together? If you have both Medicare and Medicaid, Medicaid can provide a secondary insurance. Medicare would be your primary or your first provider. So they'll pay first, and then Medicaid may cover any remaining costs like coinsurance and co-payments. Medicaid can help pay for your premiums. In many cases, you will automatically be enrolled in a Medicare savings program. In the state of Maryland, we have 4 programs, 2 specifically for prescription drug plans, and then 2 as well to help you pay with other care. So your MSP may pay for your Medicare Part B premium and then additional assistance. For example, depending on your income, you may qualify for QMB, which is an amazing Medicare savings program that not only pays your Part B premium, but helps you pay for your co-payments, your deductibles, and other things like that. So it's important to be screened to see if you qualify for these programs. Medicaid can help lower the costs for your of your prescriptions as well. So if you have Medicare and Medicaid, your drugs are usually covered by a Medicare Part D and Extra Help. The Extra Help program helps with prescription drug costs, and it locks in your the cost of your prescription. So if you have a generic brand of drug in the 2026 year, you're going to see that drug is going to cost you about $5.60, where if you have a brand name drug, it's going to be about $12.60. And that's if you qualify for the Extra Help program. Dually eligible individuals are already automatically enrolled in Extra Help. Medicaid can offer care coordination. Medicaid Managed Care, MMC, plans may offer optional enrollment in Medicare Advantage plans designed to coordinate Medicare and Medicaid benefits. So there are different types of Medicaid. Let's go figure out what they look like. So one program is for the aged, blind, and disabled. This is also known as ABD Medicaid. It covers a broad range of health services, including doctor visits, hospital care, medical equipment. ABD Medicaid may also pay for Medicare cost sharing. Medicaid Home and Community-Based Services, HCBS, waiver program. These waiver programs cover services to help you stay at home or in a community-based setting. Example, an assisted living facility. Services may include personal care, homemaker services, case management, adult daycare, skilled nursing care, therapy services. We have an amazing waiver program here in Baltimore County, and if you're interested in learning more about that, be sure to call the MAP office, and they can assist you with seeing if you qualify for the waiver program. Institutional Medicaid, Medicaid for residents in nursing homes, covers room and board, nursing care, personal care, therapy services. To qualify, you must need a nursing home level care or meet specific functional eligibility criteria. So let's do a little knowledge check. Want to make sure you're understanding what's going on. True or false? Medicaid is a federal program that is the same across the country and provides health care coverage for people with limited income. What do you think? The answer is false. Medicaid is a federal and state program that provides health coverage for certain people with limited income and assets. While there are some similarities, each state runs different Medicaid-funded programs for different groups of people. True or false? If you are eligible for both Medicare and Medicaid, you can enroll in both programs, and you might sometimes be referred to as dually eligible. What do you think? True. If you're eligible for both Medicare and Medicaid, you can enroll in both. And some people may say you are dually eligible. Here's the next one. True or false? Dually eligible means you are enrolled in original Medicare and Medicare Advantage plans. Well, if you paid attention to the first question, you already know the answer to that. False. Dually eligible means that you have Medicare and Medicaid. You can enroll in original Medicare or a Medicare Advantage plan, and both types of coverage will work with Medicaid. People with Medicare and Medicaid have extra Medicare coverage options. If you're dually eligible, you may choose to enroll in a Medicare Advantage plan called a dually eligible special needs plan or a DSNP. True or false? If you have both Medicare and Medicaid, your prescription drug cost will be completely covered by Medicaid. What do you think? False. If you are dually eligible, Medicaid can help you lower the cost of your prescriptions. Dually eligible people are automatically enrolled in Extra Help. This program helps with prescription drug costs. And if you'd like to be screened to see if you're eligible for Extra Help, please call the SHIP office. True or false? Institutional Medicaid is for residents of nursing homes. What do you think? The answer is true. Institutional Medicaid is designed for residents in nursing homes. It covers room and board, nursing care, personal care, and therapy services. To qualify, you must need a nursing home level of care or meet state-specific functional eligibility criteria. So take action if you're interested in seeing if you are eligible for these dual eligible programs. Contact your local Medicaid office to learn more about Medicaid programs in the state and how you can apply. Your Medicaid office may be called the Department of Health, the Department of Social Services, the Department of Insurances, or any other name. Contact your state health insurance assistant program, which is also known as SHIP, to learn more about how Medicare and Medicaid can work together. Here are some additional resources that you may want to take down. You can call the National Helpline, the Baltimore County SHIP office, or the Baltimore County Maryland Access Point. Thank you so much.